Welcome to Adapt NCLEX, and thank you for joining us. NCLEX review, as usual, on the go learning. We're going to walk through a case. So, assuming you have like a 28 years old a client, I would say it's a female, right? So, you have to pay attention to the bars where I'm going to give you. It's a female came into the emergency room. What is the complaint, right? Complaint of basically a couple of symptoms. So you got to pay attention to that, which of fatigue. One, you have fatigue. Then you have numbness, and maybe blurred vision. So it's episodes of blurred vision. Over the past maybe six months. So that's the main thing the patient said. Okay. And so key fact is these symptoms comes and go, right? They comes and go back and forth. Some days is worse, okay? Other days you get better. Sometimes you feel really good. So what do you think is going on? You should start thinking about what I'm trying to give you. So some days she can be like symptoms free, we call it. There is no symptoms at all. And some days you feel really, really bad. Recently, okay, a patient complained of experiencing, I'll use this word, tingling sensation in the arm and the legs. That's recent symptoms. And also feels like pins and needles when it happened. But this is worse, okay, when it's hot, overheated, or hot outside. Do you have an idea what is going on with this patient? There's something should be telling you something is not right with this patient. The patient lost the job because of what is happening, so worry about lost the job, okay? So get fired or just decided to leave the job because of fatigue. And then because of the symptoms that is unbearable, pins and needles that keep on going and having problem, I can't do anything. Especially when it's hard, she cannot work. And occasionally report about dizziness and then difficulty concentrating. Or I would say coordination. And this usually worse when she's experiencing blur vision. These are hard case studies sometimes you get, or fatigue. I know you're wondering what is going on. Well, you should be able to figure out what is going on. I'm giving you clues. Does it come to you? And she said, well, no recent infection, no injuries. So this is a review of system or no stresses that you can think of that has happened. There's no smoking, there's no smoke, no alcohol, there's no drink either. And then no recreational use of drug. Can you figure out what is going on? 28 years old, a complaint of fatigue, numbness, episode of blur vision over the past 6 months. And these symptoms comes and go. Sometimes they're worse, sometimes feel really bad someday. Sometimes symptoms are free, no, so you can go without symptoms. And recently is experiencing tingling and sensation in the arm and legs. These are described as pins and needles and worse during when it's hot outside. And she left her job because she get tired all the time. and then feel dizzy, difficulty concentrating and coordinating. Um, no infection, no injuries, no stresses, or you can think of no smoking, no alcohol, no recreational drug use. You have to put the buzzwords together. If that's not enough, let me give you some more information. Maybe this may help you. Okay, so the vitals, you took the vitals, they are normal, right? The temperature is 98. Pulse is like maybe, I would say 70. And blood pressure is like 120/70. Respiratory rate is like 16, starting like 100% in room there. So these are your vitals. So you should know everything is normal, right? The patient is alert on rented ×4, right? Does that give you a clue? At least you should be, you may know something that is going on, right? Lungs and lung is clear. Heart, there's S1, S2, there's no mama that you can hear of. There's a S1, S2. And you do the neuro exams, you find something. So sensation, right? This is the neuro exams. So I'll change the colors too so that you can focus on the neuro exams. So sensation, so there's decreased sensation, right? There's decreased sensation to light touch on the right arm and maybe the leg. So that's what you find. Can you figure out what is wrong with this patient? In the motor exams, you feel maybe 4 out of 5 strength in the right upper extremities, and then right upper extremities left, and then or maybe upper extremities and the lower extremities. They both 4 out of 5. And you did a coordination. Some patient has some ataxia, okay, and they unsteady gait. Can you figure out what is going on? They can all, and then you do a vision problem, you find nystagmus, right? You have mild nystagmus. I'm giving you all the symptoms that you should see for this condition, right? This is the key aspect of the patient's symptoms. What do you think is going on with this patient? Before the 6 months, she had one like 8 months ago and was seen in the emergency room in the ED. What do you think is wrong with this patient? Is what? What are the possible neurological problems you're thinking right now? It cannot be diabetic neuropathy because I've never given you any diabetes information, right? There's no diabetes information, so it can't be diabetic neuropathy. So you have to think about what possible neurological problems can present like that. What are possible things that can cause this problem? Okay, so I'll give you options, right? Is this myasthenia gravis? Is this a ALS? Is it GBS? Is it multiple sclerosis? This is how you take a test. At the back of your mind, you asking yourself, oh, what are the possible diagnoses? Is the differential, right? Is this, diabetic? Somebody's a diabetic, a neuropathy. Well, what are the possible diagnoses that can happen like that? And then you look at each other and you say, what is this? Is this myasthenia gravis? Is it ALS? Is it GBS? Is it multiple sclerosis? Is it diabetic neuropathy? Right. If it's diabetic neuropathy, the examiner has to give you signs patient is diabetes, has diabetes. There's nothing in the case that say the patient is diabetes. So these cannot be diabetic neuropathy. Is it myasthenia gravis? You have to think, right? What is myasthenia gravis? The keyword, what is the keyword you're looking for in myasthenia gravis is this. This is, I call it buzzword. Okay. You're looking for let me clean. You're looking for specific words. So I call them buzzwords. So for this, I'm looking for um, weakness mostly at night. Okay. And they're strong during the day. Day two, they can have blurred vision or anything like that. But in the case, I have to say this word for you to pick that as an answer. If I say ALS, well, I have to give you a lot of spinal cord and brain injury problem or muscle problem. But at the same time, I have to tell you, patient has a severe clunus, muscle contraction, spasticity, all of them. Is not, the story does not sound like up and down, right? GBS, I have to tell you, there's a recent infection, which is mostly GI or upper respiratory infection. And then for multiple sclerosis, we call it remitting and relapsing symptoms. And they are very complex. And this is example of multiple sclerosis. This is what your board will give it to you. There is symptoms all over the place, and they keep on coming back and forth, right? It was not one symptoms. He has fatigue, he has numbness, and blurred vision. This happened 6 months ago. It keep on going back, relapsing, remitting, uh, and the disease process is happening in space of time, back and forth, back and forth, back and forth. And that is your classic presentation of multiple sclerosis. This is multiple sclerosis, fatigue, numbness, and blurred vision happening in the span of time over 6 months. Sometimes when it's hot, you get better. Sometimes when it's cold, you get better. Back and forth. She has fatigue, she loses her job, she's blurred vision, she has neurological problem. It does not fit any other diagnosis than myasthenia, multiple sclerosis. You should pick. So, what are you going to do? What do you think? The patient has fatigue, is worse during this. So, it's a fatigue, right? Which is worse when it's hot. Well, so what are you going to do? Okay. The best thing you need to do for this patient is to schedule activity early in the morning. So, schedule activity in the morning, since so that when it's not hot, or in the evening instead of in the afternoon, because when the temperature is cooler, right? When the temperature is cooler, this is going to help them compensate heat worsened what they call neurological symptoms in this patient. So avoid it. You tell them to measure the temperature of their tab so that they don't um, basically hurt themselves. So that's the first thing you would do with this patient. Okay. It's very, very important. This patient is going to get a brain MRI. So brain MRI to look for specific symptoms. Who know what you're going to look for in the MRI process? So this is a demyelinating condition. And what would it look like? It look like plaques. You see plaques in the brain. So if you see a question like that, plaques in the brain, this is scarring in the brain consistent with um, multiple sclerosis. Question. If the patient reports like pins and needles, pins and needles in the hand, what diagnosis will you give this patient? If they ask you, give them a clinical diagnosis based on the pins and needles, what do you do? What would you say? Um, what would you tell? How would you class nursing diagnosis? Remember, this is going to cause a problem for the patient. So the way to answer that question is going to cause problem. Pins and needles, they have neuropathy-like symptoms. So it's going to be a risk of injury. That's the key, risk of injury to this patient. Related to what? This is how you make nursing diagnosis. Risks of injury, because pins and needles can cause injury because of neuropathy. So risks of injury related to what? Change in sensation related to sensation, and probably coordination issue. So that's how you can answer questions related to that problem. What medication are you going to give this patient? He's going to get immunosuppression. So immunosuppression is what they usually give this patient. And it can be steroids, it can be DMARD, right? DMARD can be anything, disease modifying therapy, basically. Those are medications that we can use to help with the immune system. And the idea is to prevent the progression and reduce the frequency of the symptoms. You have to tell the patient these are the progression. The problem is progression and the frequency of relapsing problem. You have to teach them about signs and symptoms related to the steroids and the DMARDs, right? Who can give me an example of a DMARD? Disease modifying therapy, basically like hydroxychloroquine is one of them. So this patient will need one of them to help them take care of what is happening to them. To steroids, you have to give it to them because they have to know the side effect of that. Few question fundamental. We have the patient has unsteady gait. Okay, what recommendation will you provide to this patient? So I'm going to start. Probably grab bar is good for the patient to have it so that they don't fall. Maybe proper lighting is good. What else? Area rag away, right? You got to make sure the area is like free, free as much as possible. Safety, safety, safety. If they say soft rag, don't pick it. Soft rag is more likely to trip you. So don't. And then make sure you check the water temperature. Okay, water temperature as much as possible before, even though this one is not for a gait issue, but these are some of the things to prevent injury from the patient. So that's some of the things you teach them, but you have to make sure that they understand that. And especially for the steroid, they cannot stop the steroid right away. They have to taper the medication in case something, before they develop adrenal insufficiency. Give to this patient severe spasm. What medication should be provided for this patient in order to help with the spastic behavior? If I give you option, prednisone, maybe be baclofen, maybe sumatriptan. So let me put this here like that. Sumatriptan, and maybe acetaminophen. Which option would you choose? Option for spasm. Which medication would be good for this patient to prevent spasm? Which medication? These are a class of medication you have to know. So which one is good to prevent spasm, and we can use it in this patient? You know, acetaminophen does not do that. Sumatriptan is for migraine, right? Steroid is an anti-inflammatory. So just by default, baclofen, we got to prescribe baclofen to the patient. But this is a case, this is like I told you, this is a quick one. So this is what you're going to use for this baclofen to help with the spastic disease process. So this is a quick case to help you understand. And let's recap, go back and see how you can recognize multiple sclerosis. 28 years old, female, fatigue, numbness, blurred vision, okay, over 6 months. It comes and go back and forth. Sometimes she's fine, sometimes it's not. She feel pains and needle. You get the symptoms get worse when it's hot. She lost a job because she can't concentrate. She's blurred vision. She has no infection problem, no injuries, no stresses. The vitals is all normal. On exam, there's sensation, decrease in sensation, some weakness, ataxia, some blurred vision. She has similar symptoms in 8 months ago, right? And then all constellation of symptoms rule out myasthenia gravis because there's no weakness at night, or patient is strong during the day. ALS, there's no severe weakness that you can think of that is with the bladder bowel injury that I can tell you. And GBS, there's no recent upper respiratory infection or GI problem. And diabetic neuropathy, like you said, there's no evidence of diabetes. We have a process where there's a remitting, relapsing of symptoms back and forth. And this is classic multiple sclerosis. And we went through the process of taking care of this patient. If it's hard, yeah, let them do things when it's cold. They need an MRI for their brain to look for demyelination. And then the treatment is steroid or immunosuppression. Any one you can choose: hydroxychloroquine, methotrexate, steroids. Acute case, you give them steroid. You have to teach them precaution with any of these medication. We talk about the gait, and because of the safety problem, you got to provide safety instruction. And this is the way they will present the case related to multiple sclerosis. Thank you for joining us. I hope you learned something. If you need more, you can check down and subscribe to Adapting Class. Good luck in your exams, and bye.